Today I'm talking to David Pearson. David, would you like to tell us something about how social care is changing in Nottinghamshire?
Well, of course, we've just had the implementation of the most major change in legislation for social care in 65 years in this country, in the Care Act, which does describe how the future of social care could be and what people can expect. So that includes very good advice and information that will be required. Trying to prevent or delay the need for people to have care and support by helping people to maintain their independence and their well-being. It actually describes the need to maintain people's well-being. And then the legislation also sets national eligibility criteria. In other words, who can be entitled to social care services and what might they involve. For the first time, it will also mean that carers, informal carers, family carers, can get services as well as have an assessment. So quite some big changes, Alan, and quite important ones, and will have a major impact on care in Nottinghamshire.
David, can you tell us what people are likely to be able to expect if they ask for help now?
There's a very important part about information and advice, and the County Council has a directory of information called Help Yourself, and we have a customer service centre where we've got trained staff who help to give people that advice at the first stage. So that's the first thing. Secondly, there might be, as part of that, the opportunity to provide people with help in relation to equipment and adaptations. So that's an important source of help. It might be that we are advising carers about how they can get help to have a break or to meet other people who are carers, where people can share their experiences and gain that kind of support, because so that people aren't necessarily isolated.
Right. Yes.
I think the other thing is that we do provide services that help to prevent things, so things that help people to get back on their feet or maintain their independence, focused with perhaps the health service in doing that, making sure that people, if they've had a period of illness, help with their recovery so they can maintain and regain their independence. And then another element of the service is, of course, then going through to an assessment that we do with people so that they can then develop a support plan which will lead to a personal budget.
So the individual is becoming more and more important.
It's absolutely essential, Alan, that services are designed around people's needs, and I think that's an essential element of both well-being and what the Care Act is trying to achieve.
Quite obviously, what you've told us is very complicated, but how are you helping people to understand these processes that you've been talking about?
If people need some help to navigate the system, and because of their circumstances, we can also provide independent advocacy, which helps people, somebody outside the council, but to help people with those arrangements. We also are providing different information in different ways. So fact sheets, we have a new website that actually provides quite a considerable amount of information. It's every part of the journey. Once people make contact, as far as possible, there are different ways of people getting the support they need.
In what you've just said, you mentioned people being available to gain information online. Some people may find that quite daunting, particularly elderly people. How can they best be helped?
I think, Alan, what we're recognising that more and more people, including older people, are accessing the internet all the time. And what we want to do is just provide the opportunity for people to get that information from the internet and from the County Council's website. But also, we're planning to take that even further, actually, so that if people want to complete the information for their assessment online, because it's got to be more easier and convenient for people if they feel that is the case, then we're enabling people to do that. But for people who want that direct contact, either over the telephone, we've got our customer service centre, and we are also, for people who need face-to-face contact, offering booked appointments.
David, all that you've been talking about is clearly going to cost quite a lot of money. I wonder if you'd care to explain how, with the current cutbacks and future cutbacks, the council is likely to be able to manage to support all these changes that you've been talking about.
Now, some money has been made available for the CARE Act, but we do know that this is a matter that needs to be kept under review, and there's constant discussion about more money for the health service, and in that discussion we obviously need to think about the needs of social care, because the two organisations, the two services, need to work very closely together and dealing with the increased needs in our communities. But aside from that, it's terribly important, as money is tight, to make sure that local organisations, we are working closely together to make every pound stretch, so that we know that we're doing what works for people, with people, that we are producing the services, developing the services with people who use them, so that we know that we are making the best use of public funds, but also that we're not duplicating, so we're working increasingly closely between health and care, and with housing and with other organisations, to make all that work as best it can. We will continue to work on the right information to help people to get the right care in the right place at the right time.
Thank you. Excellent. David, it's been a pleasure talking to you.